Two viruses, two continents, one country caught in the middle. In the jungles of Congo, Ebola has slipped its borders. In the cabins of an Antarctic cruise ship, Hantavirus did the same. Now dozens of Americans are being pulled out, watched, isolated, tested. One kills up to 90%, the other has no vaccine, and both are knocking on the same door. US health officials are reportedly monitoring a growing Ebola outbreak in Central Africa, while dozens of Americans are also being observed following a separate hantavirus exposure linked to an Antarctic cruise ship. According to a report by Newsweek, the US Centers for Disease Control and Prevention said a small number of Americans are being withdrawn from the Democratic Republic of the Congo and Uganda after possible exposure to Ebola cases, following the World Health Organization's declaration of a public health emergency of international concern.
We are assisting those directly affected by the outbreak following the World Health Organization's declaration of a public health emergency of international concern. The outbreak has so far included 10 confirmed cases and 336 suspected cases, 88 of them fatal, in the DRC, along with 2 confirmed cases and 1 death in Uganda.
According to the CDC, the risk to the American public remains low, but officials warn the outbreak remains highly concerning because of Ebola's severe fatality rate and ability to spread rapidly between humans.
While the risk to the American public remains low, the outbreak is of notable concern given that associated death rates range from 25 to 50%.
The warning comes weeks after a hantavirus outbreak aboard the Antarctic expedition cruise ship MV Hondius left 41 people across the United States under monitoring after possible exposure either directly on board or indirectly after travel. According to the World Health Organization, both Ebola and hantavirus are considered highly dangerous diseases with elevated fatality rates. Data shows hantavirus cardiopulmonary syndrome carries a fatality rate of up to 50%, while Ebola outbreaks historically have ranged from 25 to 90%, depending on the strain and access to treatment. However, health experts cited by Newsweek said Ebola is viewed as the greater immediate concern because it spreads more easily through human-to-human contact and has a long history of rapidly escalating outbreaks in vulnerable regions.
Ebola can spread between people from direct contact with the blood or body fluids of a person who is sick with or has died from Ebola disease, or from surfaces contaminated with those infected fluids.
Hantavirus, meanwhile, is typically contracted through exposure to infected rodents, including their urine, saliva, or droppings. Human-to-human transmission of hantavirus remains extremely rare. The two diseases also differ in symptom timelines. According to health authorities, Ebola and hantavirus belong to different virus families. Hantavirus is part of the Bunyavirales family, while Ebola belongs to Mononegavirales. Symptom onset also differs significantly. Hantavirus symptoms can appear 1 to 8 weeks after exposure, while Ebola symptoms typically develop within 2 to 21 days. Hantavirus symptoms include fever, headache, muscle aches, nausea, vomiting, and abdominal pain. Ebola symptoms include fever, fatigue, sore throat, vomiting, diarrhea, rash, and kidney or liver complications. Transmission patterns are also different. Hantavirus generally does not spread from person to person, while person-to-person transmission is common in Ebola. The two viruses also affect different organs. Hantavirus primarily targets the lungs and kidneys, while Ebola impacts the liver, vascular system, and multiple organs. Their animal reservoirs differ as well: rodents for hantavirus and fruit bats for Ebola. Case fatality rates vary widely. Hantavirus pulmonary syndrome has a fatality rate of around 38%, while HFRS ranges from 1 to 15%. Ebola fatality rates can range from 25 to 90%, depending on the outbreak and strain. When it comes to vaccines, no approved vaccine is currently available for hantavirus. While Ebola has approved vaccines including Ervebo and Zabdenomvabia. The biggest practical distinction is transmissibility. Ebola spreads between people and fast. Hantavirus, in most cases, is a dead-end infection picked up from rodents, not passed on. That's what makes the current Ebola outbreak the one keeping health officials up at night. 10 confirmed cases, over 300 suspected, 88 deaths, and counting. The CDC says it is continuing to assist affected Americans and monitoring both outbreaks closely. But with Ebola now declared a public health emergency of international concern, the window between low risk and global threat is narrower than it looks. 2 outbreaks, 2 viruses. And for the Americans caught in the middle, the waiting has already begun. The World Health Organization has declared the Ebola outbreak in the Democratic Republic of Congo a global public health emergency after suspected infections surged past 300 cases and deaths climbed towards 90 across eastern Ituri province and neighboring Uganda. This is not the more familiar Zaire strain that drove previous Ebola epidemics. Health officials confirmed the outbreak involves the Bundibugyo virus, a rarer and less understood variant for which there are currently no approved vaccines or targeted treatments. The WHO now warns that the true scale of infections may be significantly higher than reported due to limited testing capacity and ongoing insecurity across the region.
After having consulted the DRC and Uganda, where the Ebola disease caused by Bundibugyo virus is known to be currently occurring, I determined that the epidemic constitutes a public health emergency of international concern as defined in the provisions of IHR.
Uganda has already confirmed imported cases tied to the Congolese outbreak, including one patient who died in Kampala after traveling from eastern Congo. Another confirmed case has reportedly emerged in Goma, a strategic city now partially controlled by M23 rebels. Health officials say fatality rates for the Bundibugyo strain can reach 50%. The crisis is unfolding inside one of Africa's most volatile conflict zones. Armed groups linked to the Islamic State continue operating across Ituri province, complicating contact tracing and forcing medical teams to work under military protection.
The Bundibugyo strain has no vaccine, no specific treatment. This strain has a very high lethality rate, which can reach 50%.
The WHO says border closures are not recommended, warning they could drive unmonitored crossings and worsen regional spread. Instead, neighboring countries have been urged to activate emergency response centers, intensify screening, and isolate suspected cases immediately.
Significant uncertainties remain regarding the true number of infected persons and the geographic spread of the outbreak.
This is now Congo's 17th Ebola outbreak since the virus was first identified there in 1976. But unlike previous emergencies, this one is spreading through mining corridors, conflict zones, and urban centers simultaneously. Central Africa is once again confronting one of the deadliest viruses on Earth without a proven vaccine to stop it.